according to the interwebs. If you don't want to be weird at work, deliberately staying later than everyone else, even though you're not actually doing anything productive. That's if you don't want to be weird, don't do that. And this one, coming into work obviously sick, not only weird, but very unfair to others who might catch it. And strangely, I've worked with people like that. To that end, want to welcome Rik Heller to the program. Rik is an expert on the spread of infectious diseases, which was that something you aspired to be when you were like 10, or is that something you grow into, Rik?
Well, my favorite project was fifth grade on diphtheria and how it spread.
Oh, my. Well, and actually you did, you founded the company Wello, the first hands-free self-service temperature screening device.
That's correct.
All right, so what, first of all, explain that, because I want to get into weird people at work coming in sick, but tell me what this device does, because it looks fascinating.
Well, when we go to the doctor, they point this soft little gun at our forehead, and they measure our temperature. They may not even tell us, but they check us to see if we have an infection coming on, in which case they put us in another room or they tell us to wait in the car. And so what our device does is it's completely hands-free, and the person walks up, it gets some verbal instruction. You position the head perfectly, and then we take your temperature. So it's an AI-based device, and it's the only FDA-cleared device of its type, and a medical device at that.
Does it, if it detects a temperature? I mean, do we start hearing the warning sounds or anything like that, or is it just kind of display them and let you make a decision?
Well, we're against trauma, so we put up a little red box, and that's how we signal. And then we send to the infection control officer, who could be at manufacturing, in a office, and in particular in a hospital, and tell them that this person should be tested.
Here's the weird thing, because and maybe this has come more to the forefront in the last couple of years, but there was a poll here recently. 3 in 4 workers still feel an obligation to come to work when they have a cold. 57% would prefer if their sick colleagues would just stay home. So these people who decide, even though they are sick, wheezing, coughing, hacking, sniffling, etc. And I've worked with people like this in the past, who come into the office and their stuff is oozing out of their nose, and it's nasty, but they're like, well, I really had to get this project done, and I had to be here. What the hell is wrong with these people?
Well, unfortunately, there's less of them. COVID did bring in a much greater awareness of all of us towards sickness. We even take special notice to when we're feeling a little bit bad. But then there's the people who are going to power through the day, the people who are in management who don't believe that their employees can function or do a good job while they're not there supervising. And then there's the people who have paid time off, and they need to go on a vacation in a month, and they need to save their days. Those are the people.
And it doesn't seem to go through their mind that, it's possible I could be spreading this schmeg through the entire office. And it's but let's go over the obvious things. First of all, that obvious hotspots for germs in the office.
Mm-hmm.
What would those be?
Well, I mean, we share a microwave in many cases. We do in our offices. And, we wipe our eyes 100 to 1,000 times a day. This has been studied and well known. And so there's this moment where, we wipe our eyes, it's on our hands, or however we got it on our hands. We push the button, somebody else pushes the button. The next time they go and wipe their eyes, and now the virus, the bacteria has spread.
Oh, it's on elevator buttons.
Elevator buttons, I mean, you name it, anything that I touch that you touch. On our device, you have to touch something, but you can use a pen or just an object that you're carrying, so you don't have to pass that along or get it.
Let's see, and things like the copier that it's kind of the communal disease spreader there in the office. People are touching that, like you said, wiping their eyes, wiping their nose. And the worst is when somebody comes in and they decide they're going to type in the name of the website that they need you to go to. So they reach across your lap and they start to, handling your keyboard and your mouse. And it's like, plus they're breathing in your face.
Yeah. We look at our keyboards and they could all do they would all like to be wiped down even from our own stuff. Yes.
Right, exactly. Yeah, I know. It's funny when you go to clean your keyboard, and it's even just been you working on the thing, and you realize the schmutz that's all over it, and the keys have gotten dark brown and black. What when you developed this device, the Wello, and is it called? It's called the Wello, right? I mean, that's the name of the.
It's called the Wello Station X, and that is what is got the FDA clearance. So you'll see it around town. You'll see it all throughout the world, actually.
And when did you come up with this idea?
This is about 10 years in the making. We were putting temperature sensors all throughout hospitals in particular and some manufacturing that were just checking everything from refrigeration to, in many cases, oncological serums and things like that. They were wireless. But we were looking for what's causing the hospital-acquired infections and how it moved around the hospital. And what we found out is that people who are actually visibly, if not visibly sick, they could be seen through by way of a fever. And a fever really is the tell for how much virus you have. With the exception of those who apply over-the-counter medications, come to work feeling good, they're actually exhaling a great deal more virus, believe it or not, with a lower temperature because they have those drugs in their body, and they're not doing themselves a favor. It extends illness and the like. So we were looking for that, and so we realized in talking to the CEO of Baylor, as a matter of fact, that this is a thing that we really needed to concentrate on the most, financially and for health reasons.
Let me ask you that. I was in the hospital last year. Let's see, it was a late part of last year, actually 2021, so a year ago. And because I had COVID pneumonia, and they put me in one of those rooms that had the little air sucking device in the corner, and it was the negative air pressure room. But then whenever anybody walked in the door, it felt like there was a hurricane blowing right at me and headed toward this air collection device. This filter device. Wasn't I just getting pegged with all kinds of nastiness that was in the air?
You are. It's kind of triage the issue with that, and we became very popular in hospitals for measuring that pressure to make sure that it was what's called negative or positive. If you are sick in a room, for whatever reason, they don't want to be sending it out into the hallway. They would rather the hallway come into you. And I think it's a reasonable gamble. Alternatively, if you're immunocompromised, they would like it the other way, so that for obvious reasons.
Wait, so I was being bombarded with all kinds of nastiness, even though I had pneumonia, and I paid extra for that. Is basically what you're saying?
Yeah, it's a common technique.
Gotcha.
Hospitals are doing some wonderful things. They're trying to get us out of there as quickly as possible. Not because it's hazardous, but we are talking about fractional possibilities. But still, they'd like us to be outside the hospital for just that reason of hospital quarantine.
Would they? I mean, come on. When you're getting some cash for somebody sitting in a room getting all the schmeg, blown right by their face, I think they're willing to let me stay a little while longer. I don't. This could just be my skeptical attitude toward there. But the Wello device looks very cool, especially in this day and age where people seem to have forgotten that you can spread diseases, by sneezing. It's, just don't sneeze on people. That'd be a great start. But people can get more information on the Wello by going to your website, right? Which is?
Which is Wello Inc., WELLOINC.com.
WelloInc.com. Again, Rik Heller, appreciate your time and your advice on this, and for actually letting me know that I did pay extra to have probably a lifetime of stuff blown right by my face while I was in the hospital. Appreciate it, my friend.
Be well.